Thank you very much for coming. So this talk is, as you can see on stage, the various roles of collagen, because I don't think there is enough talk about specific issues with collagen, because there are lots of products on the market today which talk about producing collagen. But in my opinion, there is not enough detail to know whether it is a good enough product. And the problem with the marketing for me is that it is largely based on opinion. And everyone can have an opinion. If I make a product, I will say it's the best. But there are ways of analyzing products, which I will show you today, that use no opinion. And when you analyze products in this way, that's how you can compare products with each other, which I think is the best way to do it. So a lot of today is not related to this product. It is not related to the brand at all. It is purely biology and biochemistry, which is the same for every product on the market. And I think that's the best way to analyze these things. So there are multiple products in the range. I'm not going to talk about how to treatment plan today. I just want to give you an introduction into how these things work. So this is a little bit about me. I won't talk too much, but I will say that I've worked in cosmetic and longevity medicine for many, many years, over a decade. I'm also a consultant in biotechnology research, specializing in bioenergetics or mitochondria and proteomics as well. I also work with professional footballers, cricketers, boxers, even in the Bundesliga as well. And we work in the field of sports performance optimization. And what we do in the sporting world, in the world of mitochondria and protein, is exactly the same as what we do in aesthetics. And I really do mean that. It is exactly the same. There is no difference whatsoever, because all you are trying to do is improve the function of the cell. That's it. And the same thing is universal regardless of which field you are working in. So I will get straight into it because I don't want to run late. I know this is Germany and you love to work on time. So when we talk about producing collagen in any product, I have many, many problems with that, with the way that it is sold, because I don't think there's enough detail. So typically when we think of collagen in our head, we think of this type of structure here on the right, which is this green structure. We think of this spiral. That's not really collagen. That is one piece, that's all. And what is on the right and what is on the left determines the specific type of collagen that we have. Would anyone like to tell me how many types of collagen we have in the body? Don't be shy. Okay. So the fact that this isn't very well known, I think, is part of the problem. So there are many, many types. This is not even all of them. There are 28 types of collagen. And certain types are found in certain parts of the body to do one function, and other types are found in other parts of the body. If we're trying to improve skin quality, if we're trying to increase the tightness of the skin, we can actually define skin tightening and skin quality based on the specific proteins that are there. And it's not just collagen, by the way. If you just increase collagen, the function actually doesn't increase that much relative to if you can increase everything. For example, if you have, I used this example yesterday, if you have a small child growing up into an adult, they don't increase type 1 and 3 collagen. They increase every type of collagen in the skin, as well as lots of other proteins. The reason a product usually will only make collagen type 1 and type 3 is because it's so easy. If I slapped one of you in the face, you would probably make type 1 and type 3. If you have an injury, you will produce scar tissue, which is based around things like that. That's why most products in the market today, even in this conference, will only make very limited types of collagen and very limited types of protein in all circumstances. To produce what the body would naturally produce by itself, if we were going from a child to an adult, that's a different question entirely. And that's where we work with the body using physiology and not inflammation. When we inflame the skin, and traumatize and irritate the skin, that's when we produce very limited amounts of proteins because that's how we defend ourselves. That's how we close a wound very quickly. If you analyze a scar and you analyze the collagen produced from most products on the market, surprise, surprise, it's not that different. And there's very good reason. If you look at this structure of the skin, this is simplified. It's not the full structure, but at the top, where you can see me circling, that is the keratinocyte, and then here, around here, we have the dermis. So this section in between is the dermo-epidermal junction, which I'm sure we all know. Now, just understanding this simple picture will show you which proteins are required to actually produce tight skin. The red fibers here, they represent collagen type 1 and collagen type 3. As you can see, they are not in the dermo-epidermal junction. That is the junction there. And they are structures that are held in place by other collagens. So at the top, this section here, that is collagen type 4. This section here, all of these, that's collagen type 7. Now there's even more than this. There's 5, 6, 8, 10, 16, 17. I don't want to make it too complicated. But I'm just showing you that this is why multiple collagen types exist. Again, this is nothing to do with the product. This is nothing to do with me. This is nothing to do with any brand. This is just anatomy. Our very anatomy requires multiple types of collagen. If you want to make something tight, if I want to take two pieces of fabric and stitch them together, they cross, and the stitching goes in between, and we pull the stitching tight, and they are held together very tightly. It's the stitching that keeps them tight. There is a stitching in the skin between the epidermis and the dermis, which for some reason people don't talk about. But you can see very simply that there are multiple types of collagen. So if you increase type 1 and 3, which is the red ones here, how can those have function without the other types? You can see the type 4 here and the type 7, they hold the 1 and 3. So if I was to hold an object like this, I only have 2 hands. So there's only a certain number of chairs I can pick up. It's not complicated. So if you only have a certain amount of these proteins, what function will you get by just increasing type 1 and 3? Again, it's not complicated. And it's nothing to do with the brand, nothing to do with me, purely anatomy. So the point is, skin tightening can be defined by the presence of multiple protein fibers, and multiple protein strands. Not based on opinion, but based on anatomy and fact. So if you want to keep these tight together, you must look for a product that is able to produce multiple protein types, because I've just shown you, if you only increase type 1 and type 3, there's only so much the body will allow you to have. If you keep on increasing, the body will induce collagenase and break the collagen back down. Why would the body let you create unlimited amounts of the same collagen found in scars? It wouldn't. There is no organ in the body where you can just keep on increasing one type of collagen without a safety mechanism stopping it going too far. That's why we have scarring. So if a product or a company or a brand or someone talks about elasticity, I want you to ask the following question. If your product makes the skin more elastic, do you produce elastin? Because it's not collagen that makes the skin elastic. Collagen provides, as you've seen, many different functions, okay? There are structures, and collagen actually triggers chemical reactions as well. For example, the reason we can start to form a blood clot in the skin is, I won't go into too much detail, but if you're interested, it's partly because of the components within collagen type 7. It triggers these functions like von Willebrand's factor 1 alpha. Whereas elastin, really that's just to act like an elastic band. So if you see the word elasticity in any brand that you see in this congress, you must ask, do you produce elastin? Now, if they don't, then you must ask, well, how can you make the skin more elastic without more elastin? It's not a complicated question to answer. But one of the reasons I became a customer of Sunekos is because I knew it produces elastin. Now, there is really, off the top of my head, only one other product in the world that actually talks about elastin, not elasticity. I'm sure you've heard of the other product. It's a good product. But this is another one. This is another protein that we require. This is fibronectin. And again, if you have a small child growing up into an adult, a full-size adult, they won't produce just type 1 and type 3 collagen. They will produce the collagen, they will produce the elastin, they will produce the fibronectin, laminins, integrins, P105, you name it, many, many molecules. That's why we must look for a product that produces many, many different proteins. Fibronectin is very crucial for the positioning of things. In this picture, the fibronectin is the purple, almost hair clip style molecule. So that is allowing the molecules to be in the right position and stay in that position. So if you want to make sure the structure is correct, the organization, then you must have the fibronectin. So for example, if you want to take an area of scarred tissue, and I'll show you that today in a case, where there is excess amount of collagen type 1, which is why we get a scar, if you want to reorganize that to produce nice, soft, healthy skin, one of the things you will absolutely require is fibronectin. And in fact, fibronectin is required to make collagen type 7. Within collagen type 7 is fibronectin. So if you're not producing fibronectin, that's probably why you're not producing enough collagen type 7, which is holding the 1 and 3. The 1 and 3 are in the dermis. So that's how you sandwich the two layers together. And when we look at these, I'll just go back one slide, these three components, the collagen, the elastin, the fibronectin, it's not just is it being made, because a company can make a very small amount of this product and say, oh yes, we make this, we make that. But the question is, well, how much do you make? And you should not be asking, this is my opinion now, you should not be asking what percentage increase do you produce in this protein, because that is subject to the way the test has been done. I feel the best way to figure out how much is produced is to ask the company, are you able to produce more than every other product in the world? Because then it's not a percentage, it's not, oh, it's 200% increase, 100% increase, then it's a simple yes or no. And typically, most people won't be able to answer. I asked that question many years ago, all the time. And I asked it to this company. And they were the first company to simply say, yes. And then I said, well, can you prove it? And they said, yes. And they showed me the data, and they showed me the patent, and I will show you some of that today. So it's all very well and good making these things, but how much is also produced? And in what fashion is it made? If you simply induce inflammation, you will simply make 1 and 3. That's the reason we produce that. It's a response to inflammation. If you are working with the body and able to produce many, many things, i.e. make the cells work optimally, you will find many, many proteins together. So then another question you should ask is, are you working by inflammation or are you working by physiology? And again, it's a pretty simple question. There's nothing controversial, and you have a right to ask it as well. But if it's only making collagen type 1 and collagen type 3, which is found in times of inflammation, it's probably working by inflammation. So how are we able to do this? So there are two components to the product. Very, very simple. One is hyaluronic acid, and the other is amino acids as well, wherever the laser is there. Now, the hyaluronic acid, there are two different types, but it's very useless to say hyaluronic acid. Just like if you say, we make collagen, it's very useless because you have to say which types of collagen and in what amounts, and by inflammation or physiology. And when it comes to hyaluronic acid, I believe it's the same problem. You have to say, first of all, is it cosmetic grade or pharmaceutical grade? And I'll give you a clue. As far as I am aware, there are only 2 products in the world with a pharmaceutical level of purity and quality in the hyaluronic acid. One is this product, and the other, can I say the other? No, I'm not allowed to say the other. But there is one other product with the very high quality hyaluronic acid. Now, when you have any product with hyaluronic acid, typically it will be what we call cosmetic sterile. It's fine. It will work. You can inject it into someone and probably you will be okay. But when you go to pharmaceutical grade, it is like making a drug, like ibuprofen, paracetamol. You can't have any mistakes, and you have to have absolute maximum purity. This uses pharmaceutical grade hyaluronic acid. So the first question I would encourage you all to learn is which grade of HA do you use? And to have pharmaceutical grade means that in about 30 years, there has never been a single adverse event or reaction or complication ever. As well as that, you must ask the molecular weight. Within the body, we find around 1,000 to 8,000 kilodaltons of hyaluronic acid. So if I was to look inside an elbow or a knee at the hyaluronic acid in the synovial fluid, it will be a very, very high molecular weight towards, say, 8,000 kilodaltons. If I look at somewhere like the skin, it's going to be much, much lower. Each weight of hyaluronic acid has a very specific job around the body. And so if a company does not tell you the molecular weight, I do not trust that company. Now, there are specific weights here. One is 200, and the other is 1,200, which is within that range there. And they do very, very specific jobs. I won't go into too much detail, because if you do the training for the product, you will learn this anyway. I just want to introduce that to you. We also use the amino acids here. Now, it's not a secret which amino acids are used. The secret is the ratio. If I give all of you 6 amino acids in your hand and ask you to make a combination, you will all make a different combination because different amounts of each amino acid. But the pattern in the product is how much of each of the 6 do we have to produce a specific output. That's why the product produces proteins, or the collection of proteins that no other product in the world can match, in a way which no one else can match, and it can achieve an anti-aging effect, which I will show you proof of today, that no one in the world has ever matched because of that specific combination of those 6 amino acids. So what we find is when we inject, the activity of hyaluronidase, it decreases by around 40%, which allows the ingredients to work for a lot longer. And this is to show you that it's working by physiology with the body and not by inflaming or irritating the body. If you have a reaction to something, typically you will produce something and then go back down. And this is elastin production from standing in the sun outside. Now, when you have that reaction, this is what it looks like if you measure something. But when you have physiology, so you're monitoring your children growing up, it doesn't go up and down. It is constantly increasing because they're always growing. That's what happens with Sunekos. The elastin just keeps on increasing because the body is growing. It's not reacting. It's not being inflamed. It thinks it's growing, which is a big difference. I mean, there's not many products that actually make elastin, let alone are able to achieve that level of growth. And to see how physiological this product works with the body, this was a test that was done to see how long the product lasts. Now, I don't know how long the product lasts because we can't do a test long enough to find when it stops working. When you inject the product, at the beginning, you see a large increase in the cell function. Now, it looks like it drops here and then comes back higher, but there's a reason it drops. At the 3rd month in Italy, it was Christmas and the New Year, so the weather was very, very cold in winter. So the cell function reduced, but something happened after the winter was over and the sun came back. Without any treatment, the cell function went even higher than before. So that's the proof that it's not working by inflammation, it's working by improving the function of the cell by itself. And it carries on going. I don't know how long it would have kept going for. The product lasts that long that you have to take into account the time of year that you are actually measuring, which means you can't control that weather. So it's very difficult to say. So we know it lasts at least 6 months, even if you go through winter. This is another graph to show you the elastin production compared to controls. And this is, I'm sure we've all done it. We have a patient that comes in for maybe for Botox around the eyes. We pinch the skin, and then we see how quickly the skin returns back. If it's very slow, we say, okay, maybe it's not a good idea to do this treatment. This patient, at a time, if I was... Alles gut? This patient had a time when we released the skin to go back to the face of 2.5 seconds, which is very slow, very, very slow. But after just a couple of weeks, the time went to less than half. And I'm going to show you a video, not of this patient, but of another patient which filmed their treatment. Now on the left, this is before the treatment. On the right, this is after just 24 hours. And if you think you can produce elastin by inflammation in 24 hours, you're joking. And that is after 7 days. Only one treatment. So I'm going to play that, and you can see what happens. And this is filmed by the patient, not by me or the company. So the pinch may not have been the same, I admit, but you can see the results. I'll play that one more time, just so you can see. So this is not because of large collagen increase. This is because of a large amount of elastin increase, which is completely different, and what I encourage you all to ask for in whichever product you choose. So this is what the product looks like. Obviously, if you do the training, you can speak to Astrid here from Aging in Balance, or Philip, who looks after Austria as well, and they will show you all these things. Now, here is the amino acids that you can see. It's not a secret. It's how much of each one that's the secret. When you treat the face, there are two products. Where's the laser gone? When you do the training, you will understand the difference and why they work together. You saw earlier, I said there are two weights of hyaluronic acid, a low weight and a high weight. That's why we have the two products. So the amino acids are the same. The hyaluronic acid is different because we're controlling what happens in the face to the cell function. Now, anyone know what this is? Do we have any oncologists in the room? Yes. This is what we use for chemotherapy. Now, I'm about to show you why this is, in my opinion at least, the most powerful anti-aging products that's ever been invented. When we talk about aging, we are talking about, for instance, the ability to reach the stage of senescence, and essentially the cell is dead. Now, why have I brought this on the screen? Because in chemotherapy, we are trying to achieve that stage very, very quickly, on purpose, because we want to kill the tumor and age the cells so quickly they die. So if someone tells you their product is anti-aging, then the ultimate test of just how anti-aging is to put it against chemotherapeutic agents. This is not a cancer treatment at all. It's just a test to show you how much the product works in anti-aging, true anti-cellular aging. So there was a test done where this was given to some fibroblasts, and then the aging was measured. Then Sunekos was given first, followed by doxorubicin. And you can see the difference in the response in the cell. Now, this is the patent. It's public if anyone wants to have a look. And the data is there. Lots and lots of data to prove it. What it showed, if you inject Sunekos, it will strengthen the cells so much, it will resist a chemotherapeutic agent, an aging agent, such as doxorubicin. And I urge you to look that up if you think I'm lying, if you don't believe me, because it is extraordinary. And the patent has been granted for it, and no other product in the world has shown such a strong, genuine, anti-cellular aging effect. And this is another figure from the patent and the data to show exactly how it works. Here's some examples. So this patient came for tear trough filler. We did just Sunekos, 3 treatments, and you can see the difference straight away. We do have a live demo, so I'm going to get to that very, very shortly. This was a doctor who came for training. On the day of the training, he wanted to be a model, and he didn't believe that it would work for pigmentation as well. So Asian skin, like mine, is very difficult, or much more difficult, to treat dark pigmentation, especially around the eyes. This was one treatment, and that photo was on Monday. Is it Montag? Yeah. And then the second photo was how do you say Thursday in German? Donnerstag. I'm still, ich lerne. So on Thursday, it was this. And now the photo is flipped because he sent that picture himself to me on WhatsApp. So again, only it's not a pigmentation product. But when you improve the cell function, everything starts to improve at the same time, including things like laxity and texture, et cetera, et cetera. This is I believe, a 74-year-old. This was, I think, 4 sessions. Yep, 4. Again, same, came for tear trough filler. We just did Sunekos instead. 3 sessions. This is a scar. This is a 30-year-old scar. So again, because we're able to produce fibronectin, we're able to organize the collagen fibers very easily. So just with that on its own, we were able to get rid of this. You know, there's no laser involved. There's no microneedling. There was no skincare. There was no LED. Nothing. That treatment took around 30 seconds for each session. This is not my patient, someone else's patient in Harley Street in London. This is 3 sessions again, 5 mil per session. This is from NY Skin Clinic in Scotland. There's actually small areas of active acne in certain places. It's gone rid of the acne, it's got rid of the pigmentation, it's got rid of any scarring, and the texture is massively improved as well. No other treatment, no skincare, just this on its own. This is actually the body version of the range, but if you do the training, don't see you that anything. Now I'm going to show you something else. I hope you've eaten lunch already, because some of these pictures are not nice. But the technology in this product, the way it uses amino acids, that is the way human beings respond to the environment. That's why we eat protein in our diet. And to show you how strong this is, I'm going to show you some extreme examples of using amino acids from this company and the patented formula. So this product here is a nutraceutical. It's a powder you mix with water and you drink. Again, it is not used for cancer, but we do tests like that to show you just how powerful the technology is. This is a scientific paper if you would like to take a look. Again, it is public. And what happened was this technology was given to tumors, and we found that it induced self-destruction of the cancer cells, while every other cell is unaffected and strengthened. And I've got some other stuff for you. Same technology, no difference. It's just a delivery and the market that you're using it. This is a wound healing version of the product. Very, very, very young babies. In just 4 weeks, again, wound healing, aesthetics, all these things, they're the same thing. Because it's just protein synthesis, it's protein output, it's cell function. If you are good at aesthetics, you are good at wound healing, and other way around. Now, we look at other products in the market now which claim to be good at wound healing. I've never seen any of those products heal a wound like this. It gets worse, by the way. And then just 12 weeks. Yeah, newborn baby, secondary burns. Just 4 weeks. That's not just skin, that's fat, that's muscle, that's bone, that's connective tissue. Same technology. And this is where you start to look at amputation of the leg. Same technology. So it's a very, very powerful system. the ability to use the right combination of amino acids. It's not amino acids in general. Anyone can make an amino acid product. But if it was just amino acid products, why is this kind of result not everywhere? It's these specific amino acids in this specific ratio that produces results like this. And that's where the pattern is. So I think we have a live demo somewhere. We're going to do a live demo in the corner, and there is a camera so you can see up on stage. If you would like to ask any questions while I'm injecting, there are 2 microphones here. Please just come up and ask the questions if you wish. I'm just going to come over here, and hopefully the camera... We're just changing the microphone. So, if you could look to the right over here, that's it. Hopefully you can also... Oh, that's a good camera. So in this syringe here, I have Sunekos 1200. This is the higher molecular weight. It comes in 2 vials. You mix them together, and that is ready to inject. So in here, I have the 1,200 kilodalton molecular weight hyaluronic acid, and I have the same amino acid formula. Now, the Performa is going to be placed in other parts of the face. The 1200 will be placed roughly around this region that you can see on camera, about here. And I'm going to do one here as well. For the purposes of today, I'm just going to do one half of the face, and I will finish the treatment off camera afterwards. So you'll see me inject here first, and then here. Okay. Yeah? Ah. After I clean the face. There we go. Now, if you do the training, you will learn the standard protocols, which is what I'm going to show you here. But part of the training is to understand the roles of the different products in the range and actually just control what you're using based on the patient in front of you instead of treating everyone exactly the same. Thank you. So I've got my bevel up. It's a little bit awkward for me on camera, but I will try and angle myself so you can see. So the first one is going to be just next to the ala, just here. Oh, that's a good cameraman. I'm impressed. So first one just here. So the layer that I'm targeting here is the hypodermis. So I'm just under the skin. Now if I pull out, there is no rise of the skin, but if I place my finger, I can feel the product there. Now some of you may be wondering, well, you have the angular artery here, and how is it that I'm feeling so safe using a needle around the angular artery? Well, this product is not cross-linked. So there is no possibility of causing a vascular occlusion. In my practice, in fact, treating this area, I have placed it in the angular artery before. How do I know? Because instead of a round bolus, I saw a long line appear. What did I do? I simply massaged the area and carried on injecting. Because there's no cross-linking, it's not going to block anything. So it's not something I'm particularly worried about. So it's very, very safe, hence why there's never been an adverse event recorded. I'm going to go just laterally here as well. Hopefully you can all see that. I'll put my fingers either side. Okay, so. And I'm trying to do around 0.3 milliliters in each session, in each injection, sorry. Okay, yeah, patient's still alive. That's always a good sign. So I'm going to now go over here. Third injection and final injection in this point. Same layer, I'm going roughly hypodermis. What's the gauge of this needle today? What's this? 31. This is a 31 gauge. Typically I'll use a 30, but as long as you get it in the right layer, it's perfectly okay. So the final one is roughly here. The reason I pinch is just a little bit more comfortable for the patient. So 0.3 again. All good. So typically with the 1200, at most what you should see is a little bit of redness, and that's it. And I've said to the patient already, she should be able to walk out of here today with no swellings anywhere on the face and just a little bit of redness, that's all. I don't know where the lid is for that. Yeah, we'll go Performa. So I'm going to do some Performa injections here, and I'm actually then going to go, before I finish, to the eye, because I'm conscious of time. I don't want to be late for the next person. So I'm going to do some injections here. I'll finish off behind the curtain, and I'm going to do some injections around the eye for you as well. Thank you. Is this a 31? Yeah. So I'm just going to hold this on camera here. This is also a 31 gauge needle. This is Performa. This is a 1 mil Luolock syringe. And I always recommend a Luolock if possible, because if you're too superficial in the dermis, too much pressure and the cap comes off. So I'm going to try and find the bevel. I've found the bevel. And I'm going to inject from here. Hopefully you can see on camera. Yep, all good. So I'm just going to get it into the dermis. What I should see is the skin should rise. There we go. But it shouldn't be pale white. There we go. I think you can see that easily on camera. So the skin has come up, which means it is in the skin, but it's not white, so it's not too superficial. If it was completely flat, then it's underneath the skin. Now, the way I know I'm in the correct layer is I'm going to massage now, and if I've done it correctly, that should go flat very, very quickly. So I'm just going to do a small massage. So I'm pressing in, and what I can feel is underneath my finger, it is spreading out as I press. So if I let go, that should go flat. There we go. So the patient should be able to walk out with no bruising, no swelling, just slightly red from that area. I'm going to do a couple more points. Normally there are quite a lot, but I'm just conscious of time. So I want to do a couple more points here, and then I'll show you the way I inject the eyes as well. So again, I'm just feeling for the dermis, the right layer. The skin should come up, but not pale white. Again, I'm just going to do one more massage. There we go. Any pain? No? So I haven't used any numbing cream at all. And the final point here, and then I'll go to the eyes. Skin feels much thicker here, but it's also a little bit more red, so I would expect the skin to be a little more red after I finish here. There we go, and just massage that flat. Good. So the final one, I'm going to show you the eyes, and this is going to be a very, very thin needle. It's going to be around a 35 gauge. You can also use a 34, whatever you prefer. Now, typically when we treat the eyes, most products in the world just go around here, which is fine. But what I'm going to show you today is why I like this product, one of the reasons I like this product so much. When someone has tear trough filler here, that area can look great. But what we find is immediately underneath the eye, about here, there is still a sunken look, which children don't tend to have. With this product, I can actually treat this area here, almost underneath the eyelash, to actually make the entire area flat, not just where we put tear trough filler. But as well as that, I can actually treat all the way around here, and even next to the medial canthus. I'm going to show you that now. Okay. I'm just going to disinfect the area. If you could just close your eyes, that's it. I'm really sorry if this affects your eyelashes. There we go. That's all disinfected. Good. I'm glad I've got someone reminding me. So, bevel up. I will show you the needle, but it's almost impossible to see on camera, actually. Oh, you can just about see it. 4 millimeters, 35 gauge. Now, my personal preference when I'm working in London is a 34 gauge and a 9 millimeter. When it's a longer needle, it's easier to have 0 degrees angle on the skin. But I'm going to show you how you can do it with this as well. So on a nice big stretch, and I can go here, I can go here, I can go as close as I like, okay? It depends how much treatment you would like to give. So I'm only putting in the needle, a little bit of air, I'll just go here. So it should go white very, very quickly, there we go. So now that it's white, what I'm also looking for is the edge of the liquid to be very, very sharp. I don't want it to melt into the face. So you can see there, the edge is very, very crisp. The border is very crisp. And I'm going to go a little bit closer, more medial. And again, it's gone white. And I'm going to go all the way over here now. It's a little bit awkward on camera. I'll try and move around. Yep, you should be able to see that. And you can see it white there as well. Okay. So now I'm going to go in the upper eyelid as well. The key is to get a nice big stretch, which is not easy on camera. But I'll go here. There we go, very white, very quickly. And you can see the border there. It's a little bit difficult on that angle to see the border, but it is very crisp. I'm going to go over here as well. Again, it's gone white, so I know I'm in the correct layer. And you can see that on the camera. Now I'm going to go towards the medial canthus. Ideally, what I would do is have the chair much lower, and I would actually stand about here. But just so you guys can see, I'm going to do it from a slightly different angle. So I'm going to put my finger here to stretch the skin. Hopefully you can see. Yes, you can see. So I'm going to go just here. There we go. So again, nice, crisp, sharp border. Typically, I would actually go as close as possible here because you see some patients with pigmentation here. And you can actually treat that with this product. It is easier when you don't have a camera and you can get to the right angle. But you can see how we do that. If I wanted to, I could pull the skin down and actually place the product right there, very, very close. So that when I let go, we're treating where you see the majority of the volume loss, immediately under the eyelashes. And you could just close your eyes for 1 second. And if I wanted to as well, I could actually stretch the skin very slightly and even go as close as this to on the upper eyelid too. It's entirely up to you. All you would need to do is make sure that there is not so much volume, it all touches. If it was to touch, then what happens is you get one big swelling, and you don't want that. You want everything separated like this. And I'm going to show you the massage here on the patient's left, on the screen, the right-hand side. So I'm going to press on this quite hard and just move it round and round, and it should go very flat or completely flat very, very quickly. There we go. So the patient, I've never had a bruise. I've never had prolonged swelling. Typically, the swelling around the eye will last for around 1 to 2 hours. That's it. On the face, can we see the face? Can we see this? No? Yeah? So you can't even see it on camera because it's gone down so well. You can see, yeah, that's it. So there's slight, very, very slight swelling. That should go down almost entirely in about 20 to 30 minutes. So the patient can walk out looking like they've not really had anything done at all. So I hope that's given you a good introduction to the product. I'm just in time with 1 minute to spare. I'm going to finish treating this patient behind the curtain. We have a stand number 81, I think. If you look in your programs, you can find us there. Philip and Astrid are there to look after everyone in Austria and Germany, and I'll be there as well to answer any questions. So thank you very much. We'll finish up. Are you okay? Yeah, good.
So thank you very much for showing us this technique, and thank you for the brilliant outcomes you showed us. So what can we expect after a treatment? So we've seen a bit redness and swelling. Can we expect other side effects after the treatment?
Side effects? No, I've never seen any side effects. Typically, it is just the redness, which is temporary, from any needle entering the skin. Swelling, if the product is injected too deep and the product comes together as one large volume of water, then the swelling can last a long time. You might be looking at a week. But if you inject it correctly, as you've seen there, the swelling is gone almost instantaneously. So other than that, no, never been any side effects, never been any adverse reactions, never been any complications as well in 30 years.
Thank you very much. Brilliant.
Thank you. I hope you understood my English as well.